Hello, everyone. Welcome everyone to the live class today. This is Cabs here. Okay, I just want to see who is in the class today. Let's see. Raj and Deep. I can see Brenda is here. One person with the BA. I'm not quite sure what is your full name. Sorry. Charanpreet, Paru, Nasir, Rishna, Saima, and Sammy and Zakir. That's all I can see so far at the moment. So good morning, some of you, and also good evening, some of you. Before we start the class, if you want to just say something, let's see here. So what I'm doing today, you're going to actually participate in the live chat on the YouTube because I want to see other students' messages over there too in the one platform because some they might don't have the link today just to join on the Zoom meeting, just so you know. So they're just watching maybe on the YouTube. So definitely one thing we're gonna use everyone together. Now, if you just want to type in the live chat for me, everyone, I just want to make sure my voice is audible enough. And can you see me as well clearly? And also, I'm going to start the screen sharing soon. If you're going to tell me about the screen sharing as well, that will be great. And you're also joining from which country? That will be awesome. So please use the chat box in the YouTube. Okay, use the chat box in the YouTube because I would not be able to handle maybe two chat boxes today, just so you know. So I might don't see your messages on the Zoom meeting. Highly request everyone. Okay, YouTube link. Okay, I'll send the YouTube link pretty quickly as well. So just give me a second. If you do not have the YouTube link, let me see. Okay, just give me 1 second, okay? I'll try my best to send you guys the link over there soon. Some of you are with me, I can see on the WhatsApp chat, but not all of you are in there. So the one who do not have the WhatsApp group with me, highly request to join me on the WhatsApp as well, because there you will see a lot of information with me as well and study with me every day actually. So let me share the link quickly. And we will be starting the session soon as well. Okay, thanks for sharing, Navjot. I just noticed you share already the link. Thank you. Okay, I can only see one message on the YouTube so far. They said, yes, my voice is audible. Everyone can hear me. Just want to make sure before I start the class, please, if you want to just tell me quickly, my voice is audible. Because guys, this is my first time I'm telling you I'm doing a live session like this because I'm a very simple person, just so you all know, and I'm not a technology person for sure. So I really apologize if something wrong happening in here today, but I'll still try my best. I'm just a person to teach you in a simple, easy method. So let's try your best to come together and tell me if my voice is audible or not.
Yes,
Okay,
ma'am, your
perfect.
voice is clear.
It's
Thank you.
working. Okay, let's
Yes,
see here.
ma'am.
Yeah, perfect. Thanks for confirming back, Brenda, as well. And I think the other student mic is also unmute. You can always unmute your mic if you have any question during the class. Okay. You can also raise your hand if you want to, but I'm not the best person, maybe as I said, to check a lot of in the technology things. So sometime if I miss your question, just unmute yourself, everyone, because I really want you to learn something out in here today. And at the same time, I already opened the chat box, as I said, on the YouTube. So feel free to type something for me and participate in there if you have any question for me as well. So this will tell me like, okay, you guys have a question for me and I have to address it at the same time. Okay, so now we only left with 2 minutes. So let's test the system by sharing a screen as well at the same time. And I hope everyone can see my screen as well. So just give me a second. Okay, maybe I'll just do a Zoom like this. Sorry. Yeah, you can close the one tab definitely after you join if you want to, because the mainly I'm gonna see you guys on the YouTube with your as I said, the questions. But if you really want to be in the Zoom meeting, feel free if you want to participate something with the audio message. The only thing is I cannot see the chat box two different together at the same time. Let's see here. You receive a request to record the loud. Okay, well, you can start the recording as well. But this is gonna be also save on the YouTube later, just in case you guys want to watch in there as well. Okay, should we start the class? I think my voice is audible. You can see the screen. If something still not working, please let me know. Or during the class, if you want to let me know also, we can do together as well. Is everyone ready?
Yes, ma'am. Each and
Perfect.
everything is fine.
Perfect. Just want to make sure.
Thank you.
No worries. Rajan, I got your message now on the WhatsApp. I highly recommend to stay on the YouTube more because you're gonna miss the chat box questions and everyone what they're saying in there. So try your best if you want to stay on the YouTube.
But ma'am, there will be we will not be eligible to ask something, or we should write over there.
No, you can still ask the question. Like it's two ways. Either you type on the YouTube if somebody wants to ask the question with the typing, or during the class with practicing question if you want to answer A, B, C, D, right? I think it's the easy way to use the chat box for everyone, because if everyone unmuted together at the same time, maybe everybody hear a lot of echoes, right? So I highly request the chat box at that time. But if anybody has a specific question for me in any question, you want me to explain something more in detail as a rational, right? Then definitely unmute yourself, because it's just the classroom, right? So everyone needs to come together. And if you have any question, you unmute yourself at that time and ask me any doubt, any question if you have at that time. But you can still join the two screens together, I'm pretty sure.
Yes, ma'am. Thank you so much.
No worries. What is your name? Sorry.
Ma'am, my name is Samuel, and my name would be highlighted Mr. Paracetamol.
Oh, yeah, I remember now from the WhatsApp chat. Okay.
Thank you
Welcome,
so much.
everyone. Okay, let's get started now without wasting the time, because it's already, I can see 2 minutes over now. Okay. So in today's class, what are we going to discuss here? So I actually bring today select all the reply question, because I can see this is a lot of like requested topic in the WhatsApp chat, as you all can see in there. Because everyone wants to know how to handle SATA questions, what is the marking criteria for that, and definitely the strategies, how we can handle those questions with strategies. And also I can see another request, which is about the case studies. So if the class today really went well with the technology and everything, we do not face any problem. And if definitely I'll bring another live session. So most probably the next weekend. Okay. But if not the next weekend, I'll try my best to do it before if I can. So because I know a lot of students are writing exams soon. So I'll try my best to bring one case study session as well, just like this as a live session. So you can all study together with me, case studies as well, how to solve the case studies. But in today's class, we specifically gonna learn about select all the reply questions in here. And the most important thing what I'm going to discuss here is, so first of all, everybody needs to know which are the SATA questions in the NCLEX. What is the meaning of that in a simple language? Like what the really NCLEX wants from you in there. And then we will talk about the marking criteria after that. And then we also going to talk about the types of the SATA questions too. Let me see. Yeah, types of the SATA question, which I think how many types of SATA question are in there in the NCLEX. And then I'll talk about some strategies at the same time. And we also gonna practice some live questions together. And everybody needs to participate in there. So you can learn more with me, definitely. So let's talk about what is the meaning of the SATA questions, first of all, in a very simple, easy language. What is SATA question? SATA question is nothing. It's just the select all that apply. The full form is there. But what it is, basically, NCLEX give you such a questions in your exam where more than one right answers is there, but we don't know how many right answers are in there, right? So definitely this SATA question makes scared some of students as well at the same time, because they are not quite sure how many answers is in there in that particular question. Because sometimes it can be just one answer, just so you all know, and sometime maybe all of are the right answers there in the SATA question. And sometime only two, sometime three, sometime four, sometime five, and that makes it difficult for a lot of students to understand about the SATA questions, right? But in today's session, I'm going to teach you how you can handle every SATA question with very confidence. And I'm pretty sure after the session today, you will be able to apply this method in every single SATA question. More than 97%, you will find this very helpful. That's all I can say. If not 100%, I would say more than 70%, 97% still. Now, another famous question I remember I received from one of the student in the WhatsApp. I think her name is, if I remember, is I think Malik. I don't remember exactly. Sorry if I apologize if I'm wrong. So she was asking me, ma'am, what is the criteria for the how they score basically SATA questions in the exam? What if we make some questions option wrong in there? Then how the NCLEX basically testing us, and how our graphing system look like at the same time. So let's talk about that. Now, I'm just going to draw something with the pen at the same time, but if you cannot see on the screen, you really, really need to let me know at the same time as well. Now, basically the marking criteria is like, for example, if we have, let's say, total in a particular question, let's say you got total six points in there, right? Now, out of the 6 points, maybe you have only three right answers there in that question particular, right? So three right answers means your scoring will be out of three in that case, 1 point for each answer in that case, right? So 1 point for each, that means your scoring will be out of three, right? Now, the thing is, NCLEX call usually as a partial credit for this kind of system, but I personally think the easy way to remember is it's not about the partial credit a lot, it's more about like penalty, you can say, or a negative marking. That's another word we can say at the same time. Now, what do you mean by penalty or the negative marking? That means if the three was the right answers there in total, and imagine you have selected four right answers instead of three, right? But the last one was wrong. The one you selected, the first three was accurate at that time. The last one was basically the wrong, which you selected as an additional option, right? Now, anything you make it wrong in that option, remember, you're gonna lose the marks for another point at the same time. That means instead of they give you the 1 mark for this one, they will give you 0.5 now for this one, right? So that means you're losing the marks actually in there, right? So instead of getting like 3, you're gonna get the 2.5, because for the first 2 points, like one each, 1, 2, and the last one will be zero point 0.5 you're getting, instead of you're getting the full marks in there. Now the problem is not about like, okay, at least I'm getting some points, so let's try some additional to play in the exam. No, the problem is, remember, when you have the graphing in the real exam, which you cannot see when you actually performing the question, it's at the in the computer brain when they're checking your answers with the CAT test. What happen is, if this middle line is the passing line, imagine, right? This is the passing line, and this is below the passing line graph, right? This is above the passing line graph, something above, we call it above the passing line, something below the passing line, but this is the actual passing line, the one I draw in between. The problem is when you actually lose some of the marks in the SATA question, your graph actually go down. So imagine if you're already above the passing line in that particular question, you are actually losing the marks in there, right? Even if you lose 0.5, you actually gonna go down one number down in there in the graphing. That means eventually you're losing overall in there, right? So definitely I highly recommend everyone, do not play with those options in SATA question which you do not know for sure. Only play with that answer which you know 100% sure this is the right answer. Does not matter for me even if you pick up the one right answer in there overall, right? Doesn't matter, but only pick up that answer which you know one, like 100% this is for sure this is the right answer. Now why is it like that? Imagine you did not pick up the first two options here, you only pick up maybe the third answer here which was correct, and the last answer again you did not pick up, you only pick up one answer here. That means you're getting one number out of three, right? Now in this one, where your graph is going to be in reality, your graph does not even go up, doesn't even go down. In that case it will just stay in there, right? That means if you're even not gaining at the same time, you're also not losing at the same time as well, right? That means at the same time, you will be just sticking in there. Now the NCLEX will ask you the next question from there, right? So this is like very beneficial for a lot of students now to pass this exam in a very smart way. Like if you don't know, it's better not to play because at least your graphing will not go down as well. Now I can see a question here by Baljinder. How about the REXP and SATA marks? It's the same thing for the REXP and also Baljinder. And even if it's somebody here writing down the NCLEX PN examination, I think Brenda joined here from the NCLEX PN as well. Same criteria from the NCLEX PN as well. So NCLEX PN, NCLEX are an exam, REX PN, not the CPN and RNE. That's I'm not going to talk about in this one because their marking criteria is different. So if anyone writing one of these three exams in here, this is the same criteria will apply in your question. So that means do not play extra options in the SATA because the more extra you're playing, the more you're losing the marks if some of the options are wrong in there. Try your best, only pick up that answer which you know. I hope everyone understand this topic. Any confusion until here for me? If anyone has any doubt, you can also unmute yourself at the same time, please. Thank you. Or is it all good? Maybe you want to say in the chat box or something, or if everybody's okay, should I proceed to the next? Okay, I can see some chat box. I know in the Zoom. Yeah, sorry guys, I cannot open that at the same time because it's two different systems. Okay, I can see one yes from there. Is everybody understood until here? Okay, seems like yes, but you can always unmute yourself to me, right? Now let's talk about the how many type of SATA questions will be there. Now, in my understanding with the NCLEX exam or REXPN or the NCLEX PN, doesn't matter which exam you're writing down, I think the SATA questions are two different kinds, right? Does not matter that SATA question you get in case study or without case study. It's still two different kind. What I feel like, number one question I have seen, which is a very general specific question, and there you will apply more common sense actually, which I'm going to show you today. And the second type of SATA question, which is exactly bookish knowledge type of question, right? So for example, if I ask you sign and symptoms of pneumonia, select all that apply, A, B, C, D, E, and you only pick up that answer which you know as a part of sign and symptom of pneumonia, right? So one type of question is like a bookish type of question, which I always call like exact same answer what you read in the content, right? But the second type of SATA question is about where it's like a general question, general statement. They give you a scenario. Maybe they are telling you the patient come with this type of symptom and this is happening right now. This is a vital sign. Like what you will gonna do in their nursing intervention or teaching, health teaching, discharge instructions. So basically the other type of questions are general type of questions, what I call, and there most probably you're going to use the common sense. And why? I'll show you today in those questions. Okay. So these are two different kind of questions in the SATA questions, and don't get afraid from them. They're gonna be your favorite for sure after watching the class today. Now let's talk about the most important thing is about the strategies. Okay. Now in the strategy, I want you to write down something. If you have pen, pencil, something along with you, it's very good if you want to make your notes at the same time, because I'm gonna discuss some rules in here. What do you need to know when you're performing any question on the SATA? Like, how do you find out the answer, right? So number one, everyone, please write it down, is whenever you're reading any questions in SATA, you really need to find out the keyword. As I always says in my other videos also, like you need to find out the keyword into the question. Now, a lot of students, they know this thing, but someone who do not know, I'll show you how to find out the keyword today as well. It's always before the last line where you're going to find out the keyword. So for right now, write it down. Number 1 point is find the keyword into the question. And next to that, write it down is it's always hiding before the last line. Right? So this is the very important, because if you do not know the keyword, I'm pretty sure you're going to pick the wrong answer in there. Right? Now, number two in the rules is when you're doing SATA questions, I know a lot of students, they are thinking like in term of true, false, yes or no, but I don't know if that works for you guys or not. Personally, with me, it never works. Okay. What works for me, that's I'm going to share with you today. So second point, write it down, is always think every option as a good idea or as a bad idea. Good idea, bad idea. Why good idea? Why bad idea? You will see with me in the next slide when we're going to practice some questions together, right? Good idea, bad idea, because I think if personally I'll tell my brain, oh, what's good idea here? What's bad idea here? I actually catch more in there in every single question in easy manner. And it actually works with a lot of students too, who personally tried this strategy with me before as well. See if that works with you also, right? If does not, you let me know, right? Anytime during the session, after the class, in the WhatsApp also, even in the chat box on the YouTube, wherever you're watching this video, if it does not work for you, you let me know. Then I'll give you some other different type of strategies, right? Now, the number three rule is when you're doing the question, as I already mentioned, is only pick that answer which you know 100%. Something you don't know, better not to play, right? Now, the number four I want to say in here is most of the time, general statements are the right answer. General statements are the right answer. Now, what do I meant with the general statement in the answer keys? General statement means something generally which can be, apply anywhere in the world. So for example, maybe you are trying to telling the one of the option, like all visitors need to wash their hands before they see their client. Well, this is just the general statement because it can be applied anywhere, right? Or let's say another general statement is report to the physician if you have symptoms like this, this, this. It could be any symptom, but definitely you need to report the physician, right? So basically what I'm trying to saying with a general statement is something when you read it and you are like, oh, this is generally apply everywhere in the world. Doesn't matter what type of question is in there. It's a common sense. So this is something you're going to pick up in the rules also at the same time as well. Now, the last rule I want to talk about in here is at the practice time in your home, not in the real test, I'm saying at the practice time at home, if you feel like at the practice time in the home, like you read one of the option and you feel like this option sounds good to me, not a 50-50, but you are maybe more than 70% sure about that statement, this is the right answer because maybe you read about somewhere, right? Usually it's a right answer. Try your best to play with that option at home in your practice, not in the real exam, I'm saying. Why at the practice time at home you want to try that option, see if it works or not? Because this will help you to build your own strategy, right? Then you will get to know like, okay, if I try to play with that option, who sounds to me 70% correct? Usually if it's a right answer for you, then definitely you want to try that in the real exam as well. But for some students, maybe it does not work, and then you don't want to maybe take a risk for that option, right? So only if you feel like it's more than 70% correct to you, not something a guess answer 50-50, maybe not, better take it out, right? Now, another rule, I'm going to give you one keyword. If you want to write down another word as well, another rule here for me. If you ever you see in the answer options, the words like can be, maybe, might be, okay? Can be, maybe, and might be. 100% usually they are the right answers in the SATA questions. Okay, if you want to play with that option very safely, please proceed, because most of the time 100% I would say they are the right answers, because maybe research happened before on that particular point, we don't know, but they're trying to saying in that option can be happen like this or maybe happen like this if you don't go there, or might be. They're not taking a solid statement like guaranteed statement like this is going to happen for sure with your patient, but they said can be, maybe, might be. For example, the blood pressure might can drop down as well if you do not proceed with this medication. Well, it might be, we don't know, right? Because you never know if that research happened before in somewhere on the Google, maybe in a different university, somewhere in the different country, right? So most of the time I have seen the answer keys which include the word can be, maybe, might be, they're the right answer. So that will save you a lot of time as well at the same time. Now, the second thing in here, after you knowing some rules, now keep these rules with you because we're going to apply in the next screen pretty faster, right? Now, the second thing what you need to know in here in my session today, which I think most of you're in here in this session just because of this reason. What if you do not have much knowledge about a patient diagnosis, about a problem, or you never heard about that medication before? Because reality, what happened is, when you go to the real paper in the NCLEX, this is expected you will get the bouncer question for sure. I'm telling you, like, doesn't matter you study 50 books for the NCLEX or 100 books for the NCLEX. Okay, you still gonna get the surprising question there. This is very, very expectation for the passing level as well. Okay, there is a request table text as a topic and the content. Yeah, you can do that as well. But just so you know, sometimes I cannot see the chat box in here if you're having a question for me in here, because if I open the chat box, I might gonna lose what I'm talking on the screen. So everyone, that's why I'm saying I don't know what questions is in here already in the chat box. Even if you want to use your WhatsApp, if you cannot open this one, or YouTube, doesn't matter, go in there, because here I cannot see maybe your chat if you have a question for me, or unmute yourself, please. Now, so here we're going to talk about it today. I was talking here before, like how to handle those questions without you knowing the medication or the patient diagnosis. Now let's go to the first question today, and we're going to practice together, everyone, applying all the strategies together today with me, how to find out the keyword, what is the question meaning look like. Even I know some students like the English is a second language and they're having a hard time in understanding the question too. So I'm going to go over everything in here with each and every single question and how to find out the answers as well. So let's see the first question on the screen. You can also type your answers in the chat box, please. But again, as I said, the chat box, I cannot see, unfortunately, at the same time. I don't have two systems together with me in here. So I cannot see maybe your chat box on the Zoom. So please try your best to use the chat box, either WhatsApp if it's easy for you, the group, or maybe just go to the YouTube and use the chat box in there. Try to type in there your answers, okay? What do you think you could be? It's a right answer for sure. Now, when I read this first question, right, it says a nurse is caring for a client who was recently prescribed methadone for severe chronic back pain. The client reports taking the extra doses within the last 6 hours due to recurring pain. Now, which assessment finding during the discharge would require the nurse to recommend continued hospital monitoring. Now, a lot of time, what's going to happen is when somebody see this question on the screen, they will be like in the real paper, oh my God, it's a big question by the NCLEX, right? So they're going to get scared for sure, but don't be scared because you need to find out the keyword and make your job easy for sure, right? So before the last line, now, if this is the last line of the question, I can see it's starting from which assessment and it's ending until here. That means before than that, my keyword is, I can see extra doses. Oh, extra doses within last 6 hours due to the reoccurring pain. This is something the client is reporting to you. And this is my keyword right now. What is not my keyword for sure? Methadone. I'll show you in a minute. Okay. I know a lot of students, they will solve this question based upon the knowledge on the methadone. Now here, one thing everyone, if you have a good knowledge for sure, please then you use your knowledge first to answer this question. But if somebody do not have a much knowledge about the medication, this is the example for you, like how to handle the question even if they change the medication name here, how to handle the question even if I did not read about the methadone medication here. For first of all, you need to know what it is, but if you do not know, that's okay. Strategies are in there for you. Okay. Now here I'm gonna find the keyword first, which is extra doses within last 6 hours due to reoccurring pain, right? Now maybe I'll pick someone in here, or any like whoever is volunteer person here, they can just unmute yourself and you can just participate with me, one student at a time, please, and unmute yourself. So basically you will see after finding the keyword with me, what is a good idea, what is a bad idea, which answer you want to keep it in or which answer you want to take it out, right? So maybe if any volunteer, just unmute yourself. If not volunteer, I'm just gonna say the name then, okay? Any volunteer for me who want to unmute yourself quickly? You want to try this question with me? Okay, maybe I'll pick that person, the one who talked earlier, Mr. Paracetamol. Sorry, I forgot your name back again. It's a short-term memory. A lot of students. You remind me of the name back again if you can. But if you can unmute yourself, that will be awesome. Can you come in forward with me, please? Unmute yourself. Are you here? Okay, if you're not here, I'll call to the next person maybe now. Baljinder. Baljinder, can you unmute yourself, please? Guys, this is the class. You need to participate. Not just I'm talking, talking, talking. Otherwise, it will be a recorded session, right? Baljinder, are you here? Can you participate with me? Or Rajandeep? If you're here, can you listen me? Rajandeep?
Yes, ma'am.
Okay, who is this now? Rajandeep or Baljinder?
Rajan.
Rajan. Okay, Rajan, come forward now. Now,
Yeah.
if I ask you a question, one of your patient take the extra doses of medication about 6 hours ago, right?
Hmm.
And the pain is just happening again and again. It's a reoccurring pain, and you are the nurse here handling this question in here, right? So which thing make you feel out of these statement that patients still need to stay in the hospital? Because this is what they said in the last line. They said which assessment finding during the discharge time require you, the nurse, to recommend the continue hospital monitoring for this patient again, right? So now if I ask you the first point, client fall asleep while the nurse is speaking. Do you think, Rajan, are you concerned about it? If I'm your patient in this scenario and I just fall asleep at the same time while you're talking to me, do you think it's concern for you or no?
Yes, ma'am. Because of she took the extra doses, so it could be.
Mm-hmm. Okay,
Mhm.
definitely.
Yeah.
So just think as a general,
Okay.
common idea, common sense. We're not going to apply much around the extra doses or whatever, say the method on in the question, but I'm just asking you a general question in here. And this is why I'm here teaching all of you, use your common sense always. Even if, let's say, I change the name of the medication here. Let's say I just say even diuretic. or fentanyl or a beta blocker. Doesn't matter which medication in the world, right? Or any other narcotic, maybe if you want to relate with the pain medication, right? So imagine if I get falling asleep while I'm talking to you right now, if I just start sleeping during the session, do you think it's concern for you as a nurse? What do you think,
Yes.
Rajan? Definitely. You
Yeah.
will be like, ma'am, what is happening you? You just fall asleep
Yes.
now on the screen. What's going on? Right? So what I'm trying to saying everyone in here is like, even if they change the medication name for you, even if they change the statement above, right? But still something happened before. And because of that, you don't know, this is just the reason behind the show you in the question. But what I'm trying to telling you, if you see the first point, if I start becoming sleep on the screen while I'm talking to you, you should be concerned about it. No, everyone, what do you think? Right? So first is a good idea. Good idea, bad idea. Why it says good idea to keep it in? Because this is something you're looking for. Like something make you feel the patient need to stay in hospital still, right? So this is a good idea to keep it in, right? The client complained of frequent itching and the scratching from the skin. So what do you think, Rajan? If I'm scratching my skin again and again, or I have a itching a lot frequently, is this something itching gonna make me like to die? Do you think that's something make you feel like I have to stay in the hospital?
No, ma'am.
No, right? This is not concerned, right? I know it further required to look after the patient, like how come the itching is there? Like, let me look into this. Let's do some further assessments, right? But that's not going to stop the patient to go to the home, right? You can still look at the assessment and give the medication and patient can still go home. But what about if you see, now this is a bad idea. I'm not going to keep it in as well. Now, if you see the third option, the client has had the 3 episodes of vomiting since the starting of the medication. Do you think you're concerned about it, Rajan, if I have already 3 episodes of vomiting?
Yeah, ma'am.
You might want to
Yes.
keep it in now to the hospital. What do you think?
Yes. Yes.
Definitely. Well, I think I need to put this person again into the hospital. Let's collaborate with the doctor. Might need to check the antidote, might need to check the IV fluids as well. And we don't know if any dehydration happened at the same time. So let's do something further again with this patient. So let's keep it in. It's a good idea. So I'm going to play with this option in as well. Now, the next one we have is cardiac monitors show occasional PVC. Occasional. Now, some students that don't know maybe much about the PVC, what is PVC? For those students, I highly recommend something you do not know in the SATA question, better not to play the option, right? But if someone has a good knowledge about the PVC, they know PVC in a simple short language. If I say it's a skipped heartbeat, right? And always remember for the NCLEX, you only concerned about this PVC if someone skipped the heartbeat or have a PVC on the ECG more than 5 in a 1 minute strip, more than 5, then it's the emergency. Otherwise, it's not an emergency. So here they just said occasional, and I don't know how much occasional, how frequently in there. It just say occasional. But is it still something gonna make you feel like, Rajan, you're gonna stop me in the hospital still?
Ma'am, I'm not sure about this option, so
Better
I
not
will
to
not
play.
go. I
Yeah,
will
better
not.
not to play. If you're not
Yeah.
sure about it, better not to play. Anyone here, you want to unmute yourself? You think like yes or no, you want to keep this person inside the hospital or you want to still let them to go home because it's just occasional right now.
No,
Anyone?
ma'am.
No? Okay.
Because
What is
there is
the
yeah, ma'am. Because this is occasional. We if there is an any like a five to like a more than five, so definitely we need to just put the patient on cardiac monitor. But in
Mhm.
this case, they will show like occasional, so we can't imagine that situation, ma'am. So
Very
I
good,
think no.
very good. Can you remind me your name again, please?
Ma'am, Mamta Malik, Mamta Malik.
Mamta, okay, yeah, sorry. See, I was remember your last name, Malik. I was not
Oh,
like
no
sure your
worries,
first
ma'am.
name.
Actually, there
Okay,
is
well,
only Mamta
welcome
Malik.
to the session. I think you just joined now. So Mamta, definitely it's a good answer, the one you just gave it. It's just occasional, and I don't know how frequently they're talking about in occasional, right? So I'm not gonna stop this patient. Definitely, you tell them to follow up right, to the doctor if required, if they're feeling more at home, this kind of symptom, but you check their medication before they go home. But I'm not going to stop this patient to stay in the hospital just because of occasional PVC. Now, what about Mamta? If I continue with you now, like this time, sorry, Rajan, now the next person gonna switch at the same time. Everybody participate here, please.
Okay,
Now,
ma'am.
oxygen saturation is 92%. Does that make you scared, Mamta, or not? Do you want to still keep the person in the hospital or not yet?
Ma'am, according to me, the saturation is 90, should be above the 93, right, ma'am?
Very
So,
good.
so that is 92%. There is something that is can be happen with the patient in future if we just send to the patient to the home. So we need to just continue monitoring to the patient for further evaluations, ma'am. I think so because that is 92% only.
So you
We
feel like
need
92% means you want to keep it in hospital or send home?
Ma'am, actually, I'm ambivalent in this question. Actually, more than 93, I want.
Very good. If stick to your knowledge, something you know
Yes.
for sure, always stick with it. Very confident, go with the gut, always. Now, something you're feeling like, oh, 92, it's a little bit down even as well. I think it's a better idea for safety reason. Let's continue monitor this patient still and send the patient home
Actually,
later on,
and
right?
along with that, this is not a COPD patient. In that patient, we can expect like a at around 88%. So we can send the
Okay.
patient to the home as well. But in that case, I don't know.
Very good. Now, once you pull up the COPD at the same time, I want to let the students know as per the NCLEX, remember until 80% is okay for COPD. And if it's 80 or less than 80, you should be very concerned about it, right? As per the NCLEX, I'm just talking about the answer keys. If in case that will be helpful for you in some upcoming questions on COPD in some scenarios, right? Because COPD is their favorite and they will play a lot with the oxygen saturation for sure in some questions. So anyways, the answer for this question final is 1, 3, and 5. 1, 3, and 5 is the final answer for this question. And anytime any student has still any further doubt for me, always jump in into the session, unmute yourself, and you can ask me the question back again. But I hope everybody understood how to handle this type of question in there. Let's proceed to the next question faster. The more we go further, the more we're going to learn in here today. Now here I can see it's a pregnant woman with a 15 weeks gestation scheduled for amniocentesis. See, now reality, you know what happened when students, they read the question, they are like stopping here in the paper. They are like, oh, I didn't know read about the amniocentesis and they are asking me question on this procedure. But hold on. And see the bottom results in there, you know, the answer key, and ask yourself if this is something really knowledge question or not yet. Okay, so don't freak out and make yourself scared when you read the question in once. This is my advice for all of you, because I know this is what happened in reality for especially repeat test takers. I know they can correlate it. As the client is being prepped for the procedure, it becomes clear to the nurse that the client does not fully understand the risk and benefit associated with the procedure. Now, which of the following describe the nurse role in obtaining the informed consent? I hope everybody know about the content related to this because I already posted earlier. But let's see, the keyword is patient does not fully understand this everything with the procedure. So what is basically your role at that time when the patient don't understand anything? Now, do you think this procedure may matter for you a lot? What about if I say here it's a paracentesis procedure and this is like 35-year-old, maybe a male client come to the emergency today? Still my answer is same, right? So what I'm trying to teaching you guys here, the question can be rephrased. So try to understand how the NCLEX question rephrased and answer is still same in there, right? Now the answer, let's see one by one. The first option says explain the risk and benefit associated with the procedure. Do you think, can you explain the risk and benefit, or is it gonna be done by someone? Is it in your role in practice? No, wonderful. Let's take it out. Any other student also at the same time you want to participate it, please come forward, unmute yourself. Don't feel shy in here. That's why you are in here with me today. You need to learn. And I can see some messages from Navjot, Arsh, Sani. So try your best to participate in there, okay? I'm not quite sure about the other messages, as I said. Try your best to type messages, either the WhatsApp, because I have a phone with me right now on the other side, or type the messages only in the YouTube, whichever works for you. But I cannot see the chat box in here for sure. So you cannot explain the risk benefit. Let's take it out if you're confident, because that is done by the surgeon or by the physician, whoever is in there, right? Describe the alternative to the procedure. Do you think you can give the alternatives also? Like, Mr. John, if you're not going for this procedure, then what procedure you can go for it? No, this is not in our scope of practice. Let's take it out this one too. Bad idea, right? So think about good idea, bad idea. First is a bad idea. Second is a bad idea. I'll take it out. Witness the client's signature on the client form. Can I witness a signature as a nurse? Oh, yes. Let's keep it in, right? So let's keep it in now. Now, the next one we have is advocate for the client by ensuring she's making an informed decision. Yeah, you become an advocate because you want to make sure the patient make the informed decision after being informed with everything what's going to happen in the procedure or during or after procedure as well, or what if they don't go with this procedure. So patient make a decision and then they sign for informed consent, and your job to become in their witness as well, and also make a become the advocate for the patient. Right now, this is a very simple, easy question, but this question, please, it's repeating a lot in the exam, so don't make this easy question wrong again and again in the NCLEX, because this is the easiest question which every nurse know in the world. Okay, so that's why I pull on the screen as well, because it's an easy question. Now let's give you the next question. You can always stop me again, as I said, if there is still doubt in the previous slide, so I can always go back in there for you. Now, in this question, this is, I can see a question related to when you do not know about the diagnosis, right? Or when you do not know about the medication, how to handle this question together. Because a lot of time when you read this question, a lot of students will be like, what is this onychomycosis? I never read about this content. Now, Payal, do you remember you were sending me messages last night? You were like, ma'am, I want to read this diagnose, this diagnose, this diagnose. And that's why I'm making you stop in there. Doesn't matter how much you study in the world. Nursing is very vast. Medical knowledge is very vast. You cannot learn all the medications in the world from all the different countries. You cannot learn all the diagnoses as well. This is practically impossible, even for me also, believe me. Right? So, but what you need to do is you need to know a strategy, how to still handle these type of question, because still you will getting these type of questions in the exam. So let's see this question together, everyone. You are the nurse in here. Whoever want to come and participate in here with me is providing education for a diabetic patient who is given this medication prescription. See, they give you a clue. They are giving this medication for diabetic, right? Sometimes the question give you clue itself, right? But even if it does not say here diabetes, you still think prescription means medication. Simple. Keep it simple for yourself. Doesn't matter what is the name of the medication. Now, which statement by the client? So that means client statements are in here. And that demonstrate the good understanding regarding the treatment with the medication. I'm just going to say medication. I'm not going to say terbinafine, right? Well, if you guys have a good knowledge, stick to it, as I always say. But most of the students I know, they don't always have a knowledge about the diagnosis and about the medications in here, right? It's a reality, believe me, right? Now, how do you handle this question? Good idea, bad idea, use common sense, right? Now, the first point is following a successful course of treatment, my chances of getting cured is 90%. Now, let me ask you a question. If I'm your patient in here, right? Do you think any medication, any tablet, whichever I'm getting in the world, let's say I'm having an oral tablet right now, right? Do you think after getting the treatment, after getting any medication, I will be cured like completely after the successful course? Like, do you think 90%?
No.
Why 90%? Why not 100%? Why not 80%? Why not 70%? Do you think it's a solid statement? Like, for sure you will get a cure 90%, everyone? Yes or no, everyone?
No,
No,
ma'am. We
Right?
don't know
We cannot say that. How can we
how much
take guarantee
effective it
like
would
this
be.
patient will for sure, you will exactly, you will get 90% treatment for sure, like you will get pass in this case? No, right? So it's a bad idea. Take it out, right? I will have to take a medicine for 3 to 6 months. This
No,
is a general statement. Now, a lot of time you don't know about the name of the medication. Now, if it says here, I will have to take the medicine for 1 month, then I will be doubted. For 2 months, I will be doubted. For 3 months, I will be doubted. Like exact time, if it's given here. But here they give you like a range between 3 to 6 months. That means again, it's not a solid statement. It's like the patient is thinking, I might need to take this medication from this time period to this time period. So now this is the good idea to keep it in. Why? Because let's say, okay, whoever say no in here, come to the mic online with me. I'll teach you this thing. Let's imagine if I'm taking the Tylenol medication or whoever medication you want to give me right now today, right? And if I take that medication for a particular time, a particular day for sure, right? Then you will be doubted like, oh, why you only have to take medication only for 1 month? Why you only take this medication for 1 week only? Do you think there's a guarantee you will be fine after that? The answer is no, right? But if I say, I will take this medication most probably like maybe 1 month or 2 month or 3 month, but yeah, maybe max 6 months I'll take this once I feel better. Then you will be like, yeah, I think it sounds good, because you will get an idea that you must need to take some sort of treatment, but for some amount of time, not a standard one time, because we don't take any guarantee you will be fine for sure by this time period, right? So definitely this is a good idea to keep it in rather than to take it out. For me, I'll keep it in. Now, who is here? Yes or no with this statement? Let's see what's your answer, guys. Who want to say yes? Who want to say no for this? Like you don't want to keep it in or you want to keep it in?
I will say yes.
Okay, I can hear most of the time yes on the screen, and I can see some WhatsApp messages. Yes, by Brenda. Very good. Yeah, it's a good idea. Why not? Right? Patient is like, I will take for some time. It's a good idea, right? Now, I will need liver function test before I start the medication. Now, lot of time, students are thinking, why liver function test only? They go into the question and they think about the knowledge. But NCLEX is asking you here why liver function test is important? No, then why do you overthink about the statement in the real paper? Just think as a general statement and ask yourself, doing a particular test before starting any medication in the world, is it a good idea or is it a bad idea? Especially check your kidneys or liver if they're functioning or not, right? I would say it's
Yes.
the
good idea.
good idea.
Good
Let's
idea.
keep it in. Very good, everyone. Now, I will take this on an empty stomach to help improve its absorption. This you will be doubted in here, right? Because you never read about this
Yes.
medication and you don't know, should I take the empty stomach? Should I take before meal, after meal, before bedtime or evening or when, right? Now, something, as I said, will be doubted for you. The rule is do not pick up the answer in the SATA. Okay, don't bother to play with that option. But if you have good knowledge when to take this medication, then you can pick up the answer. Now, let me tell you reality, guys. It's a very rare medications in the world that you want to take on the empty stomach, right? So I highly recommend it. When you read your Saunders book for the content, you will find some medications in there in that book, which medication specifically to take the empty stomach. For example, like your thyroid medication, right? So why not to make a list for that? Because it's hardly few medication you need to remember the empty stomach. And apart from that, whatever medication in the world they give you in the answer key, it's always a wrong answer because you never read about that in the list, right? So make a easy and a smart learning for yourself, right? It may cause a taste change or vision change. We don't know. Maybe it can happen for some patient or not, right? So I will report the vision changes to my doctor. What do you think, guys? Good idea, bad idea, everyone? If
Good.
may,
Good idea.
Good
good
idea.
idea. Why not to tell the doctor if something is happening to you, right? Now, the symptoms I can see here is, oh, let me take this screen on the side. I don't know how to go. Okay, here. So, dark urine, pale stool, persistent nausea may indicate. We don't know if it's going to be indicate or not, serious side effect or not, but any symptom they give you here, doesn't matter what symptom list. Maybe it's a side effect. for that patient, a serious or mild or whatever, right? But what do you think? Should I keep it in or take it out?
Yeah, keep it.
Keep
Yes,
it in,
we can.
and the patient
Keep
still
it
gets
in.
reported,
Keep it,
right?
ma'am.
Very good. So the final answer for this question is B, C, E, and F. See, everyone, you do not know still what is the onychomycosis. You do not know still what is the terbinum fine, whatever. You still can find out the answer. So what I'm trying to say is use good idea, bad idea. That's the first method. The second method is use common sense. Okay, because 90% question, let me tell you, in the NCLEX paper or the Rex PN, whichever exam you're writing down, everyone, believe me, 90% paper, when they give you SATA questions in there, even they are harder level SATA questions. Always, the statements make, from Google, from research article, from here, from there, you never find the same exact word, maybe from Sounders or from somewhere else. But you still need to read the Sounders as a base for yourself, right? So what I'm trying to saying is how you can find out the answer still. Use common sense at the end of the day in the exam, because lot of time NCLEX is trying to giving you clue and they wants you to pass this test. So use your common sense in there. Don't become anxious by looking at the word, oh my God, what is onychomycosis? I never read about this before, right? That will lose your confidence, and definitely you will not be able to find out the answer then if you lose your confidence in there, right? I hope everyone understand this question. As I said, you can always stop me in between. Now let's see the next question together quickly. I can see this is like a nurse caring for the client diagnosed with the right-sided CVA with dysphagia. Again, a lot of students, they will be start thinking like, oh, knowledge part, right-sided means this, dysphagia means this. But only think about that if the NCLEX is asking you at the bottom, what is right-sided CVA, first of all. Okay, so keep it simple. Just tell your brain this is a diagnosis. That's it, right? Now, which of the following action by the nurse reflect the appropriate care, good care for the client? Simple. So you take the bad statements out, basically related with your keyword. Now the keyword I can see here is CVA with dysphagia. Now if anything as a keyword, yes, you need to think about it. But if the CVA is not a keyword here, then maybe not, right? But here I find it as a keyword now because it's before the last line. Now let's participate everyone together. Nurse assess the client ability to swallow. Good idea, bad idea?
Good idea.
Good idea. Let's
Good
take
idea.
10. Now the nurse positioned the client at 45 degree. Why 45? Why not 30? Why not 90? Why not
Yeah.
any other angle? Doubted, right? You might be like,
Yeah.
I don't know if that's something I do require for sure in this case,
Bad
right?
idea.
So something you don't know, take it out because you don't know why only 45 degree in here, right? But if you have a knowledge, as I always say, stick to your knowledge. Then you do not listen my this class, because in this class I'm teaching you shortcuts, strategies to find out the answer key. Okay, so I'm not going to play with this if I'm a student. Okay, now the third option is the nurse offer the client scrambled eggs. You're not giving the whole egg, you're just giving scrambled egg. And if somebody has a dysphagia, is it easy for them to chew or not? Good idea,
Yes.
bad idea?
Yes.
It's
Yes.
good idea.
Good idea.
Good.
Good idea.
The nurse instruct the patient to instruct the client to place the food on the left side of the mouth, right? Now here, always remember, if one thing you want to remember about the exam, about the CVA client, anything you do with the CVA patient is always on the good side. Any nursing procedure, always good side. Even if you want to come in front of the patient, talk with the patient, also always good side. Any nursing procedure, good side, right? So here, if the patient has a right-sided CVA, right? Now, what is the good side of
Good
the
idea.
patient?
Left side.
Left side. Left side.
Left side.
Left side.
So left side is a good side or left side is a bad side?
Left side is the bad
Left
side.
side is good. Right
Bad
side.
side.
Okay, if someone who said here left side is the bad side, can you come in front of me, please, and tell me the rationale again?
Ma'am, because in the CVA, the like sign and symptom of the opposite side. If the right side right side, the attack of the right side, then the symptoms on the left side.
Very
And
good,
if,
my dear.
yeah, if the
Now,
left
this is
side,
the right answer, the one she said. Now, anyone who pick up the left is a good side. Let me tell you, you need to read the topic back again. Go to your neuro chapter today, take it as a part of homework and come back with me on the WhatsApp or wherever and discuss their severe topic with me. So you need to remember that right side CVA means the right side of the brain is affected. This is the meaning of this diagnosis. Now, if the right side of the brain is affected, the left side will be paralysis in here for the patient. It's opposite always. Okay. So if the left side is paralysis, that means the good side is right side of the patient. You will do everything on the right side with this patient. I'm not going to put the food on the left side then.
no,
Right?
weak side.
Now, if whoever make this wrong in here, it's okay. Go back and take it as a new learning. Why? CVA is one of the most important topic for the NCLEX. Okay, you might gonna get the case studies also on this one too. So please read and watch this topic very carefully. Highly recommend whatever given in the sounders is more than enough for the content. Now, the nurse turn off the TV. Ask yourself, turning off TV for someone who has a dysphagia problem already, is it a good idea or is it a bad idea? If you don't know, then not to play.
Good idea, ma'am.
Good idea. Very good. Why is it a good idea?
Because, ma'am, in that situation, patient don't like stimulation, so we need to
Very good.
just switch off the television.
Very good. Now, if somebody don't know about this, better not to play. Then you only stick with your 1 in 3 answer, right? So you do not lose at least the, your spot in the graphing. It doesn't really go down in there. Then you get a good marks in there, right? So the answer for this question is 1, 3, and 5. Those are the final answers. Now you can always stop me if there is still any doubt. Let's do another question without knowing the name of the medication. A lot of you maybe know what is doxycycline, right? But what about if I change this language? I say doxycaminophenocycline. You will be like, what? I never read about that before, right? So this is reality happen in the NCLEX, right? So even if you change the medication name here, answer will be still same. This is what I'm going to show you in here. So your patient basically getting a new medication prescribed here. Which of the following statement, if made by the client, would require follow-up? Follow-up means like something, why you gonna follow up in there? Because you're thinking, oh, something wrong in there, or maybe something incomplete. I need to go there and check it out. What's going on in there? Something bad, or maybe not bad, but I still need to go there and watch it out, right? This is the meaning of the follow-up, right? That means you're gonna look at the bad statements here made by the client, which makes you to think as a nurse, I need to go inside in that room and talk about this with this client, right? So the first option, let's imagine if I'm your patient here now, everyone, and I'm telling you, I should take this medication with milk or cheese. Do you think every medication mostly in the world we have to take with the milk or cheese?
No, ma'am.
Think as a general, right?
No.
Think as a general always in the SATA. Majority you will be like more than 70%, ma'am, I have a feeling no, because most of the meds not a good idea. It's very rare maybe with the milk or cheese, but not all of them, right? So what I'm trying to saying is when something sounds more than 70% sounds good to you, stick with that option. Now here, I can say this is a bad idea. I might need to teach the patient here something more further. Oh, how to take these medications then, right? So hold on to this option. If I develop foul smelling diarrhea, I should contact my doctor. Oh yeah, good idea. If I tell you I have a diarrhea, I'm going to call my doctor. Then you will be like, yeah, ma'am, it's a great idea. Let's call the doctor right away, right? So this is not a bad answer because remember, we are looking for bad answers here now, kind of, right? Lot of time this is mistake by some of the students. They forget about the question is asking for follow-up and they're looking for right answers at the bottom, right? And they
Yes,
lose
ma'am,
them.
I always doing.
See, this is the, I know already. This is your first attempt or a repeat attempt, my dear? I can't hear you. Hello? Okay, I can't hear you still. Okay, that's fine. You can always participate maybe later also in the chat box. What I'm trying to saying, this is a very common trap by a lot of nurses in the real exam, believe me, because you're in rushing, and then the exam anxiety, oh, timer is running 5 hours and you forget that the question is looking for follow-up in there. Okay. Now I need to wear sunscreen outdoors while taking this medication. Ask yourself, right?
Yes.
Like wearing sunscreen is a good idea in generally when someone go out after taking any medication in the world, or is it a bad idea?
Good
Good
idea.
idea.
Good idea. Most of the meds we do require, they're very hypersensitive. Let's keep it in. Why not wearing sunscreen then, right? Okay, I can stop this medication when I feel better. Do you think any medication in the
Bad
world,
idea.
you
Bad
stop
idea.
it by yourself?
Bad
No.
No.
Tell the patient like this is a bad idea. You need to contact the physician first, even if you feel better, right? Follow up first. So don't stop by yourself in the house, right? I should take this medication on empty stomach. See, again, same thing. You don't know, can I take this medication empty stomach or not, right? Well, if you know, then click on it. If you don't know, better not to play. The final answers for this question is letter A and letter D. Those are the only two statements I can see so far in here. Okay, let's try more question. Okay, very interesting question. Watch very carefully, everyone. I will do this fun for you. Okay, you don't know maybe what is von Willebrand's, right? You're like, how to handle this type of question, right? And they're asking me characteristics of this type of diagnosis here, and it's a select all the reply. Now remember, sometime the NCLEX giving you clue actually into the options also. So look at the pattern in there. See, you find out the pattern. Even if you don't know what is one, something, whatever it is, but if you know, it's a great idea. You're very intelligent maybe then, right? But if you don't know, it's okay. Okay. So when I read this option like easy bruising, right? I'm like, okay, I don't know, easy bruising, should I hold it or not as a part of characteristic of this diagnosis? So for right now, don't think about take it out or keep it in, just hold on, okay? Gum bleeding, right? Now see, you got a clue. Like
Yeah.
1 and 2, similar. They're talking around bleeding something. So either both are inside or either both are out together because it's a SATA question, right?
Yeah.
Now this is like
Right.
hereditary bleeding disorder. See, again, bleeding. Again, I got a clue now, right? Treatment and care are similar to hemophilia. One word, if you want to remember for hemophilia for the exam, bleeding. That's it,
Bleeding.
right? If you remember bleeding, you automatically know sign and symptom. You automatically know the treatment for that. You automatically know the discharge teaching. You don't have to read this topic in detail even as well. I never in my life as well, right? So bleeding so far. Okay, it is characterized by extremely high creatinine. One word about creatinine you want to remember for exam or for your real life also when you work as an RN. Creatinine, kidneys.
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 Related to kidney.
This is something related to the kidneys. Oh, something odd statement now. The disorder cause platelets. Again, something around the bleeding, right? See, you got a clue now for this answer. Either all of them are in something related to the bleeding or all of them are out. Something related to the bleeding. More chances you want to go on this side, right? In this bouncer question. 1, 2, 3,
3, 4,
4,
6.
6 is the right answer. See, very smart way to handle the question, right? So what I'm trying to saying is, again, hold on your anxiety in the real paper. Don't feel like, oh my God, what they're asking me right now. I don't know about this question. And think about the sounders, what page number and everything in the paper, right? You will not be able to remember. Believe me, this is practically not possible for a lot of students, right? I hope everyone understand how I handle this question. Let's see another easy question of the day. Now there is someone, you have a patient, okay, who had a stroke being transferred from one unit to another unit. See how I read the question? I'm not even going to say 72-year-old medical unit rehab. Keep it simple for yourselves. Now the nurse case manager is assisting in this process. Okay, you are the nurse case manager now in this scenario. The nurse knows that the goals of the case management include what? if you are the nurses here, you are the management person here, what is your goal here should be for the treatment, right? Let's see A, B, C, D option in here back again. Okay, so first one, improving the coordination of the care. Do you think if you are the manager person on the floor as a nurse,
Yes.
improving the care, is it a
It's
good
good
or
idea.
a bad
Good
idea?
idea.
Good idea. Let's
Good
keep it
idea.
in, right? Increasing referral to the local organization. Now, lot of time,
Bad idea.
this could be tricky for some students. I want to give you some knowledge behind the scenes here for the NCLEX purposes. Referral means referral to either maybe dietitian, social worker, maybe physiotherapist on the floor, maybe anybody else in the community you're looking for resources. It could be any referral, maybe a specialist doctor, right? Now, always remember your site, wherever you're working, you want to reduce the amount of referrals rather than increase the amount of referrals. Why? Because if your patient is using more referrals, that means your patient is not doing well. That's why you're sending your patient in there. Does it make sense? Right? But
Yes.
if you are reducing referral for that patient, right, that means your hospital staff is really doing good care. Like everybody's doing really good. Your patient just getting discharged and they're getting less referrals now, right? So that means your goal at the end of the day to make the patient feel better, not use the more referrals always. Definitely they can use it wherever they wants to, but your goal should be yeah. I hope everybody understanding my point, what I'm saying in here. Now, if it's increasing referral for your site, right? That's, you think it's a good idea or bad idea?
Bad
Bad
idea.
idea.
Bad.
Idea. I don't want to keep it that as a
Bad
goal
idea.
for my building, right? Take it out. Reduce the fragmentation of the care. Now, the nurses sometimes they don't know English language because our English language sometimes is a second language, right? And we're like, fragmentation means what? Split the word, fragment, fragmentations. It sounds like they're trying to talking about splitting something, right? So
Okay.
you provide the care in different sections, splitting, it's not a good idea, right? So fragmentation of the care, do you think I have to reduce it on the floor or I have to make it more on the floor, right? I would be like, reduce it on
Reduce
the
it.
floor. I don't
Yeah,
want that
reduce.
more on the floor, right? So it's a
Correct.
good idea rather than bad idea, right? So A is the answer, C is the answer so far. Discharge the patient quickly. Do you think you want to do something quickly? Is that a
No.
good
Bad
idea?
idea.
No.
Bad
Bad
idea.
idea.
Most of the time, quick word, wherever you see in the NCLEX, take it
It's
out.
yeah, wrong
It's a
idea.
bad answer, bad word, you can say, right? Because nothing in the nursing is faster, quickly, something you want to do as a quick nursing care. No, take it out, right? So right answer is 1 and 3 so far. Very good, everyone. Almost done. Let's see the next question quickly. Very favorite diagnose in the exam. Sometimes the case studies on heart failures, right? So here I can see the nurse is caring for an elderly patient who is a left-sided heart failure. Which of the following are the most appropriate nursing intervention to reduce the workload of the heart or to promote the comfort and rest? Now, this is the example for those students who usually get stuck between two answer keys. Why you're stuck in two answers there? Because in the question, there is two right answers, but your job is to find out the best answer in there, right? Now, what is the meaning of best answer or best appropriate or most appropriate meaning? Most appropriate meaning is, or best appropriate meaning is, more than one right answer is in here, but your job as an RN or as an LVN, if you're writing as the LP and LPN paper in here too, your job to be sure as a nurse in this scenario to pick that answer, which you have to do it at the end of the day. Like I can forget about the other option, but I'm not going to forget about this option to do it for sure. So for example, let's say, without looking into this question, let's understand from my daily routine task, right? So for example, I just woke up right now, imagine, right? And I have to eat also, right? And I also have to go and take shower also, imagine, right? Now something which is mandatory, I have to do at the end of the day, right? Like I have to eat still at the end of the day and I can forget about the shower. I can do that later on, right? Or should I just stick to the shower and I can forget about the eating whole day? Which is more mandatory? The answer is eating. because I cannot live without the food, right? Nobody can live without the food for whole day, right? So definitely eating is more important. Similarly, in this question, when you get stuck right now in front of me and you're gonna solve this question, not me, you guys gonna solve this question with me. When you're stuck here between the two options, ask yourself, matching with the keyword. So here the keyword is heart failure, left-sided, right? Match with the keyword, which is something you have to do at the end of the day, right? Number one, we have an option here is assist the client for short walks at least. They're not saying for sure you have to go to 2 times, or they are saying like for sure you have to go to the 1 time. They are saying at least 2 times. So they are giving you like a level in there, like a duration, at least 2 time minimum per shift to increase the circulation. They also give you the explanation of what you're doing. Something with the explanation, guys, is always a good idea. This is another strategy you might want to apply in some of the question. But here also think they are saying reduce the workload. So going for short walk, do you think it's going to reduce the workload? Is it a good idea? Or is it a bad idea? Is it good for the heart to promote the
Good
oxygen,
idea.
or is it a bad idea? Mostly
Good
I can
idea.
say good idea. Very good.
Good
Let's
idea.
keep it in. Provide a comfortable armchair or raise the head of the bed, right? To increase the reserve of the heart and decrease the work of the breathing. Another strategy for you guys. Anything which is very huge explanation is usually a right idea in the exam. Okay, this is
Good
something you
idea.
want to try it back again. But if you want to understand the meaning, let's imagine I'm sitting on a chair right now, or I'm raising my head off my bed, right? Do you think it will help me in the breathing? Definitely, right?
Yes.
So let's go for it. Why not? Good idea. Allow the client to lie flat to sleep.
Bad
No,
idea.
bad
That's a
idea.
Bad
bad
idea.
idea for the heart failure. This is how you think. Bad idea. Help the client walk to the bathroom rather than using the commode. Good
Good
idea,
idea.
bad idea. You are
Good
restricting
idea.
someone
Good
to.
idea.
Now, whoever say good idea, what is your name? Sorry?
Harjeet, my name is
Harjeet.
Harjeet.
Okay, Harjeet. Imagine if you are my patient here and I'm telling you, Harjeet, don't go and use the bathroom. Only use the bathroom at the bedside, right? Do you think it's a good idea? I'm stopping you like that as a patient just because you have a heart failure?
Sorry, ma'am, I did not understand.
Okay, imagine if you are my patient here, right? And
Yeah,
you have a heart failure condition, exactly,
yeah.
right? For God's sake, you're never gonna get this diagnosed in your life, right? But just imagine as a patient.
Imagine.
So you can understand this question in the other perspective as a patient.
Yeah. Mm-hmm.
So if you are my patient and I'm telling you as a nurse, Harjeet, please don't use the bathroom. You can only bathroom at the bedside just because you have a heart failure.
No,
Bad idea. Why?
bad idea.
Because you think as a patient, what? Oh, she's making a restriction on me. What if I have a heart
Yeah.
failure? That means like I
And
cannot
yeah.
walk, right? Now, if
And
you,
the this one is also related with the A, because of if we're
yeah,
gonna go for the walk for
very
to the
good.
bathroom, it's also for
Yeah,
the
then how
short
come
walk.
you are telling them
Yeah.
not to go for a walk if you already said that go for a walk, right?
Yeah.
You see, A and D, you only pick either answer. You don't play with the both options in here. I hope
Yeah.
everyone is learning here. So the right answer is very good. Number 1 and 2. That's it. Keep it simple. Let's try another question quickly, but you can always stop me if there is any doubt in between. You guys have a patient now with the scabies. I can see it's a child this time.
Sorry to
Yeah.
disturb you, ma'am.
Yeah.
Ma'am, actually, here it is mentioned help the client. So we can help the patient to go to the bathroom. Ma'am, here option
Oh, yeah.
mentioned help the
Sorry.
Yeah.
client.
This
Sorry.
one is
Oh,
a good
okay. Sorry. Maybe
statement.
I misread the statement. Okay. But let's
Yes.
say, okay. Sorry. But that's good. You make me back actually in here. Maybe I was like in
Sorry,
fast
ma'am.
way. No, you don't have to be sorry. I actually appreciate it because you pick up my mistake here. So I appreciate that. So here you want to let the patient to use the bathroom. But again, same thing. The person who pick up my this mistake, sorry, what is your name, my dear?
Ma'am, my name is Indu.
Indu. So Indu,
Yes.
again, same thing I'm gonna tell you now. If you are my patient here and with the heart failure, and I'm going to help you to use the bathroom. Does that sounds like you cannot use the bedside commode at all?
Mm.
Or
Yes,
do you
ma'am, it's
think,
not a good
as a
option, but
patient, or do you think as a patient you want to keep yourself as a more independent option for yourself? What do you prefer at that time?
actually, ma'am, I was confused because in first option we click assist the patient on short
Yeah,
walks.
yeah, for
Yes,
sure.
and in D option, help the client to walk to the bathroom.
Bathroom.
So it's
But
the
the
same
problem
thing like
is,
short walks.
the problem is not help the client to use the bathroom. This is a good statement. The problem is you make a restriction in here by saying, rather than to do this, Mr. John, rather than you do this, Miss Sindhu, why don't you
Okay.
just go to the bath? Do you understand what I'm trying to say? For
Yes,
example,
my God,
say
the
to,
point you tried to
yeah,
say
so
that
let's say if I
we are
say
making the
Hindu,
restrictions.
can you just drink the orange juice rather than you drink the cranberry juice? I think orange juice is only good for you.
Okay, ma'am, just because of rather than word, we don't
Because
choose the
rather
option.
than doing this, that sounds like you're making restriction on your patient. Do you have the
Oh,
actually a reason, a rational, a physician order something behind the scene here? No. Then
oh,
why would I nurse as a tell my patient like rather than you do this, you should do that?
okay, ma'am.
Does it
Now
make
my point
sense?
is clear.
So first
Yes,
statement, nothing problem in there for sure, everyone.
yes,
Helping client the bathroom is a good idea. But why I'm telling the
yes.
patient rather than you do this, you do that, sounds like I'm being a bossy in here, no?
Okay, ma'am.
It's a
That's
bad
why I'm
answer.
choosing the A, B, and D. But my confusion is help the client. We can
Yeah, because
assist
see,
the
now
client.
here you learn with me that you don't just look in the option walk, 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 and you click at the answer right
Okay.
away. You
Yes,
need to
ma'am.
think
Yes.
about the overall statement. How does it look like? Does the overall sounds to you I'm trying to forcing you or being bossy around you, making restrictions around you? Oh, it's a bad answer. Makes
Okay.
sense?
Thank you so much, ma'am. Thank
No
you.
worries. No, thanks everyone for picking up this mistake because why I wanted to go to the next question because before we end up the session, I want to try to show you more questions in here with me for
Yes.
sure,
Thank you,
right?
ma'am. Thank you so
Yeah,
much.
but you can always stop me because I love it when someone stop me and ask me these questions for sure. So perfect, everyone. If there is no doubt, no question, let's see this question again without, the medication. Well, they already tell you this is for scabies into the question, but let's see if you don't know still. You never read about maybe permethrin, how to handle this question, because here you need to teach the parents how to correctly apply this medication. Now, for those students here who have a kids, they know how to handle with the kids when you give the meds, right? But those students here who do not have the kids, right? Imagine this question in front of you, you have imagination kid in front of you. Then what do you think that parent, what do you want to teach to that parent regarding a particular medication, how to give it to a child, right? So just keep it simple and like a general idea. Number one, apply the lotion only. Oh, seems like I pulled this question without SATA here on my screen. I just noticed now. Sorry, guys. Maybe I put this question by mistake. It should not be on this class because it's supposed to be SATA question. But I apologize as we already see this question. It's a single answer. You have to pick it up in here. This is not a SATA question. I really apologize. I should double check my slide. So here, apply the lotion only to the visible rash area.
Wrong, ma'am.
Doubted.
Not
Why,
yet.
why they say only rash only? I'm doubted,
It's
right?
only.
Like, I'm not sure. As a student, make a question mark and compare it. Keep the lotion on the child's skin for 6 hours. Why 6 hours only? Why not 5 hours, 4 hours, 8 hours, 10 hours? No, doubted, right? Again, it's like a sounds a
Yes.
restriction again. So
Mm-hmm.
maybe let's keep the first in and delete the number 2 for now. So now between 1 and 3, do not dress the child in clothes while the lotion is on. Oh, good idea.
Bad idea.
Now
Bad
somebody
idea.
say bad idea. Okay, somebody say bad idea, you delete this one, right? Then you keep the first option. Somebody say good idea, like I would be like good idea. I'm gonna delete the number 1, right? Whichever works for you, because you're still playing with the option without knowing the medication, right? But when you read the last statement, it says apply the lotion to clean dry skin for 30 minutes after bathing. Now leave it over the night. Now
It
I
means,
see
yeah.
that They said 30
Correct.
minutes, right? This is the minimum time, sounds like they give it to you. But why
And
this is a
explain.
better answer? Because here they cover 3 different sections, more explanation for a parent, right?
Yes.
First of all,
This
clean
one is
area,
correct.
dry area.
Yes, ma'am.
Second option, they give you timer. Third option, they give
Yeah.
you like a particular instruction after the bathing. And the fourth option, they give you like over the night also, leave it in, right? So seems like this is a good answer, right? Now, this
It's
is a
under
better
relax.
idea because parents will understand more in here, no? Like the nurse tell me everything about this medication in here, like how long, minimum time, maximum time after bathing and clean and dry skin. This is how the parents like it because they will be like, you're trying to telling them more and also in a simple language as well. Anything within the teaching always has to be simple for a patient or a family member. Now here, 1 and 3 you will delete it right away because 4 is a better answer as compared to.
Yeah.
See, you don't know permethrin drug, you still solve the question. Answer is 4 for this one. Very good. Let's try another question today. The client has a new order for placement of Foley catheter due to the urinary retention. Now, which of the following should the nurse do before starting the procedure? A lot of time the nurses forget to say before. They're not asking you during and after, so take the other options out, right? Before what? Before Foley catheter for urine retention placement. Okay, you got a new order for that. What are you going to do before procedure, right? Good idea, bad idea, because it's a SATA question again. The nurse should confirm the client identity. Yep, good idea, because the procedure required proper identification. Yep, good
Good
idea.
idea.
Let's keep it in. The
Good
nurse should
idea.
confirm the client medical record number via the wristband and order. Do you think again you're confirming something? Good idea.
Good
Yeah.
idea.
Ask the client
Good idea.
her name only. Are you just gonna ask the
No.
name
No.
only? Because this is a
No.
procedure, this
No.
is not a
Bad idea.
medication. Bad idea. Because why name only? Because you think it's not a medication, it's just a procedure? No, take it out. The nurse should confirm the name via wristband and an order. Yeah, good idea.
Yeah, good idea.
See, A, B,
Good
and
idea.
D, it's pretty much similar. It's just the rephrasing of the word.
Yeah.
Right? So if you're picking
Ma'am.
up the A, then the B and D also supposed to be there. So A, B, D is the final answer. Seems like someone has a question here for me.
Ma'am, actually, I
No.
have a question. The nurse should confirm the client name by the wristband and all. Ma'am, I think so. As of now, we can't consider wristband
Relax, relax.
because it's the to identify, right? So
Okay.
wristband. I don't
Okay,
think so,
I
ma'am.
can barely hear in between the voice, but I think your question is about how to confirm the client identity. Okay, let's write it down, everyone, as per the NCLEX or as per also after you got the license, how are you going to confirm the client identity? Number one, you always ask the patient name to confirm the identity if the patient is in situation to give you the answer by themselves verbally. Number two identifier is you always check the wristband in there. This is the second identifier we always do. Now, number third identifier, which you want to remember is the health records. Health records means like either you check the chart of the patient, you put in the healthcare number in the system, you see their name pop up in there, you check the photo in there. If it's the same patient or not a same patient, that is the third identifier. And the last identifier which we have in here is asking the co-workers who is working there since very long, since with the same patient. Okay, now why I tell you guys the sequence, like how to identify everything in here. Remember, the best method is point number 1. If the point number 1 is already there in your exam, you click on that. Then you move on to the second option, the one I give it to you. That is the second best answer, how to identify the patient identity. The third best answer, the health records, which I told you, this is the third best answer. What if the first and second option, they both are not in there? Maybe patient is unconscious, maybe there is no ID band, right? So that is the third best answer, which you must need to know. And this question, just so you know, Less common in RN, but more common in the LPN exam. If someone is writing down, the LPN student is watching here, Rex PN, LPN students, if you're watching this session, NCLEX PN student, this is a more famous question in your exam. Why not for the RN paper? Because this is just a very basic common question, which is more meeting the standards of the paper of the LPN. But if someone is getting in the RN paper, just so you know, you're getting that type of question, it's a low level question. Okay. So you should not get it, but you still need to have a knowledge about it as an RN as well. But still you need to know how to check the patient identity, or just in case if any SATA question come like that. But if you're getting very simple questions without SATA, sorry. Okay, somebody mic is unmute and I can hear some background voices. Please mute your mic, everyone, if you're not using it, because that's the distraction sometimes for the other students. Okay. Okay, so now I can see here some messages on the WhatsApp. Just give me 1 second. Okay, I'll respond to this message later, Mr. Paracetamol. I can see there is a question you posted in the WhatsApp group. Okay. So yeah, I hope everybody understand what is the sequence now. The person who asked me how we can check identity, what is the method, and so on. So this should be your sequence when you're checking with someone. Okay, no room number reliable, no bed numbers reliable, because you don't know patient go to different room or different bed or so, right? This is the answer for that question, the one someone asked me. We almost done. Now, the next question we have, I can see here, the nurse is prepping to discharge a client who is stable after sickle cell anemia crisis. Now, don't think about the knowledge. You only think about the knowledge if the question is on the knowledge, okay? Which of the following instructions should the nurse provide to the client to avoid future crisis? Okay, think as a good idea, as a bad idea again. Number one, keyword is sickle cell crisis. Okay, and how you wanna
Avoid future.
future. Okay, limit your fluid intake. Can you say restrictions without physician order? Even if you know that's a good
Bad
idea, bad
idea.
idea in the diagnosis. I don't have anything as a doctor, so I'm not gonna play
Bad
with
idea.
physician, right? And definitely if someone has a knowledge, give more fluids, stick to that.
Yeah.
Okay. But
Because
today I'm
in
showing
that
you just the strategy without the knowledge. Avoid strenuous exercise. Okay. If you're telling someone not to do those type of hard working, those exercises, is it a good idea or is it a bad idea generally for anyone? What do you think?
Good
Good
idea.
idea.
To
Let's
avoid.
keep it in, right?
Yes.
You don't need a doctor order for that. Apply cold compresses to the painful area, right? Good idea, bad idea. But if you don't know, can I do cold or not? Or should I do hot in that case? Better not to play with that option.
Yeah.
Okay. Take the pain medication as ordered. They already said as ordered.
good idea.
Good idea, right?
Good idea.
Avoid tight clothing.
Good idea.
Good idea.
See, I did not even think much about the content in here. I just think good idea, bad idea, and I just go from there. This is how you do the question again. Next question I can see on the ventilator, mechanical ventilation in here. Now, which of the following intervention should the nurse take to help prevent ventilator-associated pneumonia? Okay, select all that apply. Good idea, bad idea. Repositioning your patient at least every 2 hours. Oh, good idea. And
Good
make
idea.
the head of the bed upright. See, they did not give you a particular
Good idea.
position. They give you like a
30
range. Good idea. Let's keep it in. Promote nutrition with the use of NG tube. Are you going to promote nutrition? Is that your goal with the NG tube?
No.
Take it out. Not for any patient in the world, right?
It's prevent.
Now, suction oral and pharynx secretions, okay, you're doing it, but providing thorough oral care also at least every 2 hours. Oh,
Yes. Good
good
idea.
idea. Let's keep it in. Assess the client for sedation reduction, okay, and weaning readiness as well. If the patient is ready to go for weaning, extubation procedure,
Good idea.
good idea.
Yes,
Let's
good
keep
idea.
it in. Very good. Perform the hand hygiene before and after of the care of the client.
Good
Good
idea.
idea.
Good idea.
Let's see the next statement. Implement prophylactic IV antibiotic therapy. Is that a good idea or bad idea?
Bad idea.
There you go. Now, why is this the bad idea?
because ma'am, for VAP, it's I mean prevention. For prevention, it is not apply.
Mm-hmm.
A patient is not in serious condition or any surgery is not occurring. It is applied for only before the surgery.
Okay, I will just use the simple rationale for everyone. Now, they're saying you want to prevent ventilator associated pneumonia. So, is it something you want to stop infection related to ventilator? You just go and give the antibiotic because you don't want the patient to get infection at all?
This
No,
statement
it's a
not suits
bad
here,
idea,
ma'am.
right? Sorry? Anyone has a question here for me?
Ma'am, actually, this statement not suits here. Actually, the prophylactically intravenous antibiotic therapy that is not according to the question, ma'am.
Very good. Well, if you guys have a knowledge part, as I said, just do with that part, this question for sure. But some students who do not know, when they read this question, should I give antibiotic or not? So for them, the shortcut is, remember, ask yourself with the keyword, you want to prevent infection here related to the machine, right? And then ask yourself, if you are the patient here by yourself, is that something you are expecting from nurse to give you antibiotic because you don't want to get infection? No, right?
No.
You are expecting from the nurse that she should do something else around rather than a medication, like a non-pharmacological something for you to prevent it, right? So this is how you can handle this type of question. Very good. I can see one comment there on the YouTube. Okay, whoever they said this question for me, kind Saul, and you're watching still this video, I highly recommend contact me on the WhatsApp. Okay, and I want to see your report as well so I can help you. Okay, now let's see this next question because a lot of time in the exam, you forget about the sign and symptom. Oh my God, this is second type of the SATA question where exact knowledge required, right? And you're like, how to pick up the answer? Ma'am, I'm forgetting sign and symptoms again and again. Let me show you one example today. There is still always a way to look into the question. The nurse is performing an assessment on the child admitted to the hospital with the probable diagnosis. Probably, we don't know, probably is there. And it's a nephrotic syndrome. Maybe you never read about nephrotic syndrome, but at least you know they're talking around kidneys. That's all
Kidney.
maybe you got, right? It's a kidney related, renal related chapter, right? Now, which assessment finding you're gonna expect from something kidneys related or something related to renal chapter? That's all I'm gonna think about it at the end of the day. But of course, I always tell everyone, you only apply this strategy if you do not have a knowledge. But if you have a knowledge, you know what is nephrotic, you remember sign and symptom, you go with that technique first, right? But again, if you don't remember, this is only for those students. Again, find out the pattern in the answer key itself, right? Anybody with a kidney problem, do you think they can get pillar? Good idea, bad idea?
Bad idea.
You want to keep it in or take it
Bad
out?
idea. Take it
Good
out.
idea. That means you want to keep it in. Okay, let's think maybe another way. You want to keep it in or take it out. We can think about in that way as well. So who want to keep it in? Who want to take it out? If someone has a renal related issue, Taylor?
Ma'am, yeah, ma'am, there is a
I
problem in
think this
blood.
is related to
Hemoglobin drop, ma'am. There is a failure.
Yeah,
Patient can be failure in hospital, ma'am.
patient might can be paler. We don't know, right? Okay. If anybody has a renal issue, renal problem, kidney problems, do you think they can also get edema?
Yes.
Yes, ma'am.
Yes.
Fluid.
Ma'am.
Yeah.
Do you think they also feel like not to eat anything?
Yes,
Yeah.
ma'am.
Very good. Do you think the proteinuria, protein
Yes, ma'am.
something levels will be
Yeah.
affected?
Yeah.
Very
It's
good,
Yes,
relevant.
ma'am. Yes,
right?
ma'am. Yes.
Now,
Nephrotic,
do
sir.
you think with the kidney problems, is it always possible weight loss or it can be
No, ma'am.
gain or can
No,
be
ma'am.
both? We don't know.
We
Bad or
Ma'am,
don't
not
know
we
because
apply.
it can be weight gain or because of
weight gain,
edema.
ma'am.
Now, if you are clicking edema, you should not click the
Not
weight
click the
loss.
weight loss. Yeah.
Very good, Harjeet.
Yeah.
I can hear you now. You're learning strategies in there.
Yes.
Okay. Decrease lipid levels. Guys, lipids is related to what system?
It's hard.
Lipids?
Liver.
Yeah.
Very good. Liver. Heart, I think you're trying to talking about the cholesterol level.
Cholesterol, yeah.
Very good. You can also go for that profile as well. See, with the less knowledge, no knowledge, right? For those students, this kind of strategy, I hope it's working best for you now as well. Like try to find out something into the answer key and see if you can find out something in there as a together. And you only click that answer which you know. So the right answer for this question is 1, 2, 3, and 4. Very simple, right? Let's try another question. Maybe you don't know what is otitis media of the right ear. You never maybe read about it, but at least every nurse in the world, they know itis means infection.
Inflammation.
That's it.
Yes,
That's what
ma'am.
maybe you know. Infection, inflammation, whatever you
Yeah.
want to call. Now, do you think you still need to read the topic if you already know there's an infection in the ear? No, infection means infection, right? Now, which intervention should the nurse include in the plan of care? Something you want to include related to infection or the inflammation. Now, if somebody has infection on the ear, good idea, bad idea to give a soft diet to chew.
Good idea.
Good
Good
idea.
idea.
Because ear is already
Good
aching.
idea.
Okay. Position the child on the left side. If you're not
Bad
quite
idea.
sure which positioning as a part of knowledge, better not
No.
to play in that case. Okay.
No idea.
Administer antihistamines twice daily. You don't know, can I give antihistamines or not? But ask
No.
yourself, is it prescribed? Better not to play,
Yeah.
right? Irrigate the ear with the normal saline every 8 hours. Now, some students, maybe they don't know, can I irrigate or not? Is it something with normal saline or what? Or is it every 8 hours or once a shift or once a day? Some maybe don't have a knowledge at all. Better not to play. If you don't know, can I irrigate it or not, right? Now, administer ibuprofen. Every nurse in the know, they know ibuprofen for sure. I'm pretty sure about it, right? Now, they said to give this one for fever, and also they give you like every 4 hours, and they also
Good
give you
idea.
as prescribed or as needed.
Prescribed as
Good
needed.
idea.
Good
Let's
idea.
keep it in, right? Instruct the parents about the need to administer the prescribed antibiotic, and every nurse in the world they know antibiotic always full course.
Full
Mandatory.
course. Good
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 idea.
idea.
Good
Let's
idea.
keep it in. So very good. The answer for this question is 1,
Ma'am,
5, and
5,
6.
6.
Very good.
ma'am,
Okay.
can you ma'am,
Yeah.
can you explain the first provide soft diet?
Sure, definitely. Imagine if you are my patient here and you have a ear infection or something. Do you think your ear is bothering you? Yes
Yes,
or
ma'am.
no? Yes, very good. If your ear is bothering you, do you think you can eat properly if I give you any type of food in front of you? Think about
No,
chewing.
ma'am, but
No, right? So now let's see if I give you a particular food which is easy for you to chew, right? Because you also want to think about your TMJ joint at the same time because you're chewing something and it's related with your ear now as well, right? So if I give you such a food which is easy for you to eat, you will be like, yeah, this is much better. I can eat now. Now, again, don't think as a part of like too much into the knowledge. If you know the knowledge, it's good. But if you don't know, then think as a general statement. Ask yourself, most of the patient in the world, do you think they're gonna like soft food diet to chewing it because they have a earache or ear infection at the same time, right? So do you think it's a good idea and bad idea? Just keep it simple in that way. I hope I addressed your question.
yes, ma'am, it's clear.
And any other doubt for me, anyone? We're done for today, class. Anyone, any question for me before we leave?
What was the right answer in that last question, ma'am?
Yeah, the right answer is 1, and the
5.
right answer is 5, and the right answer is 6.
Okay, ma'am. Thank you.
Yeah, no worries. So that's all about for session today, everyone. Thanks for joining with me. I really appreciate it. Now, if you guys like this class, we're going to bring the more classes than like this so you can learn something live with
Yes,
me.
exactly.
And definitely the next lecture will be on what topic? Case studies. That's another one I know you guys are requesting now. I'll show you the techniques for case studies.
Please make a
Ma'am,
topic
can
on
you
documentation. Ma'am,
Sorry?
documentation.
Documentation, yes, Mamta, it's a part of we're going to discuss in the video, or I'll give you guys the notes on the WhatsApp.
Okay, ma'am.
For the live
ma'am, can
lecture,
you
I
send
want the students to practice more on a particular thing. Yes, someone has a question for me?
Ma'am, can you send these notes on WhatsApp group?
Yep, I can send it for sure. Yeah. And I can also post here for the students who are watching me
Thanks.
in YouTube in case you're not on the WhatsApp with me. I highly recommend either add me on the WhatsApp with the number given on the screen, or either I can drop the folder here for you guys. You can just use the link as well, whichever works easy for everyone, right? Anyone has any other question for me before we leave today?
No, ma'am, thank you.
All
We
good?
enjoyed a lot.
Now, did
Thank you,
everyone
ma'am.
like the class today?
Thank you, ma'am.
Yes,
Yes,
ma'am.
ma'am. It's very
Interesting,
helpful.
very interesting.
Very
Thanks.
interesting and
Thank
helpful.
you.
And I also like it also because before I was planning actually to do the live session on the whiteboard. But then I realized on the whiteboard, you might not gonna see the screen properly, or also the, we cannot maybe put more than some amount of questions in there also, right? Then I realized to start the presentation, and I tried to figure out how to connect the Zoom and everything as well. Because frankly speaking, guys, I'm not a technology person, so I really apologize if something wrong happens sometimes. I'm a very simple instructor with the less knowledge of technology, but I'm still getting there and learning there around. So, but yeah, thanks for joining the session today. I also love this session because at the end of the day, if you learn something, I'm satisfied, right?
Yeah.
Now, let's
Lot
connect
of
with me
things.
on the WhatsApp later. If you still have any doubt, any question for me, or drop the comment section in the YouTube if someone is watching here. And I'll see you guys back again later. Thank you so much.
Thanks, ma'am.
Thank
No
Thank
you.
you,
worries.
ma'am.
Thank
Thanks,
you.
ma'am.
Yeah.
Thank you, ma'am.
Yeah. Thanks, everyone.